Hey, Dr. Gittleson. I'm Annika.
Can you hear me?
I can, yes.
Oh, great.
Thank you for joining.
Happy to be here.
The members of this group tend to be pretty prompt, so they'll all be joining in a few minutes.
Can you remind me how much time I have to present? You're muted, actually. So for some reason you're muted. I can't hear you.
That's because I'm muted. Yeah, we have just a very brief call, so it's an hour long, and I think we have about 10 minutes for you to present, and we'll have a Q&A after. We also have Rial Carver from Kansas State University's Rural Grocery Initiative, but she's not, is my understanding, she's not doing a formal presentation. She's just going to talk a little bit about her program and answer any questions too. But we have you up first, if that's okay.
That's fine. One thing is I have never used this Google Meet before, and I have no idea where to share, how to share my presentation.
Yeah. Let's see. So do you have a present option on the lower screen?
Oh, is it that like a little screen with an arrow on it?
Yes.
Yes, I have that.
And it tends to not be super compatible with PowerPoint, unfortunately.
Oh, geez. Oh, that'll be interesting. Okay.
We'll find out. Sometimes it's just like with presenter view, it won't advance the slides for whatever reason. But we can always make it work in some capacity.
Lisa, how are you doing?
Pretty good. On yourself?
Good to see you. Yeah, fine.
Yeah, it's good to see you too.
Okay, good morning, everyone. Thanks for joining us. We'll just give everyone another minute to join, but if you'd like to, you can go ahead and put your name and affiliation in the chat to introduce yourself. We'll be doing a very brief roll call for the voting members of the committee momentarily. Just as a heads up, this call is going to be recorded and posted to the council's website. So please be aware of that. And I'm also going to remove any AI note takers just because the state does not allow them currently in our meetings. Okay, we can go ahead and get started. Here is the agenda for today. So we have two guest speakers with us today. We have Dr. Joel Gittleson from Johns Hopkins Bloomberg School of Public Health. And also we have Rial Carver from Kansas State University's Rural Grocery Initiative. So we're excited to have both of them here to help you get into your conversation about addressing grocery retail issues and healthy food priority areas. If there's time, we'll look to Lisa and LaMonica to provide any SNAP and SNAP Ed updates. No worries if you don't have any for us, Lisa and LaMonica. And we'll have time for member updates as well. Any questions before we get started? Okay. So Lisa and LaMonica, is LaMonica here yet? Yeah, she is. Would you like to say some welcoming words?
Sure. I'll start off. Good morning, everyone. I'm really glad to have you all here with us this morning. I'm really excited to have a conversation on our grocery store access. I know this is a question that consistently comes up quite a bit for a lot of us. So really excited to have our speakers here to discuss grocery store access. And then, yes, if we do have time, we'd love to kind of share any updates that we have with SNAP, because I know that is in SNAP Ed, because I know that's pressing for a lot of folks. We're really excited to have you all here and looking forward to our conversation.
I just reiterate everything that LaMonica said. I think last year we had a really productive year. We actually had a lot of recommendations. And so I really look forward to another productive year. And so this is a great way to start it off. So welcome to a new year.
Awesome. Thank you both. And I realize that I neglected to formally introduce myself. As always, I'm Annika Lefebvre. I am the Resilience Program Coordinator with the Maryland Department of Emergency Management. And this is the Distribution and Access Committee for the Maryland Food System Resiliency Council. Sorry about that. And so I'm just going to do a quick roll call for the voting members of the committee, and then we'll move forward from there. I know that we have Ann Wallerstedt here for Meg Kimmel, Beth Brewster here, I believe. We have Delegate Charcudian, Anne-Marie Hart Bookbinder.
I'm here for Anne-Marie.
Thank you, Allison. Joe Liu, Nancy Nunn.
Here.
Hi, Nancy. Teresa Stahl. I saw
I'm
Teresa.
here. Thank you.
And Diana Taylor.
Good morning.
Good morning. I think I saw Diana. Okay, so just a few announcements. The next Distribution and Access Committee meeting and Environment and Production Committee will both take place on October 16th. We are in our new back-to-back committee meeting format, so we'll see how that goes today for those who are on both calls. And then the full council is meeting next week on September 25th from 10 a.m. to 12 p.m. And just a highlight, we had to change the date for the December meeting due to a scheduling conflict, so it's now on December 11th. And with that, we're going to get into our discussion today. We have Dr. Gittleson up first. Dr. Gittleson works with the Johns Hopkins Bloomberg School of Public Health and has done a lot of amazing work in Baltimore City with healthy food priority areas and innovative solutions to grocery retail. So we're excited to hear from him. And we'll see if your slides work as well.
Can I start to share them now?
I think you can, yeah.
Okay, I'm trying. Okay, present now. Oh boy. Are you seeing?
We're seeing your slides, just not in like a presentation mode, but that's okay.
Do I need to put it in presentation mode? It doesn't seem to be going to presentation mode.
Yeah.
Is that the problem that typically happens?
So the problem that typically happens is when you're in presentation mode, it won't show us the slides advancing for whatever reason.
Okay, then we won't do that. So you're gonna have to look at a little tiny screen if that's all right. So so let's see. Let's make sure this advances.
Should it be advancing?
It should be advancing.
Oh no. Let's see.
I'm trying to select slideshow.
You might just have to click on like the second slot, like on the left-hand side. Yeah, like when you want to go on the next one. Yeah.
I'm clicking on it, but it's not.
Oh, and it won't. Oh.
No. Do you want to send over a PDF of it, and we can just like scroll through that way, or try doing it that way? I'm sorry, Dr. Gittleson.
Yeah, this is terrible. Never had this happen before. So it's just not registering. It would take me a while to convert to a PDF. Okay. That's the problem. Here's what's going to happen. I'm going to do this entirely by memory. Okay. So it'll probably go faster that way anyways. So in my presentation, what I was going to start off by saying is that, generally in my work, I take 3 different approaches to different types of interventions to improve the food environment, especially in Baltimore. So one is educational, and another is environmental change, and a third is policy. And by educational, I mean helping people make choices among what's already available to them. Environmental is changing those choices for them, and then policy can support both environmental or educational interventions. And in Baltimore City, we've done a series of projects which we call the Healthy Stores projects, which we've been implementing over the past 25 years. And these have taken a variety of different forms. If you look at the Baltimore City food environment, you see that there's over 600 corner stores, 400 or 500 carry-out restaurants. There's dollar stores, about 53 of them. There's pharmacies that have food and so forth. And it's a very complex food system, actually. And really a big question is where would you choose to work? And if you're focused on healthy food priority areas like myself, the first place that we chose to work was in corner stores. So corner stores are, as you know, small retail food stores that exist primarily in the healthy food priority areas. And they're a kind of niche store. But on the other hand, they're deeply relied upon by many community members because regular full-service grocery stores are often very hard to come by or too far away. So we did a lot of work in corner stores, and our very first project was called Baltimore Healthy Stores with corner stores. We worked with about 20 stores in East and West Baltimore, and we implemented an intervention where we did point of purchase promotions for healthier foods. We've worked with store owners to stock a broader array of healthier foods in the corner stores. And we saw success in getting the stores to stock a broader array of foods, to get people to increase their frequency of purchase of those healthier foods, and even to report improved consumption of those foods. And we've followed up on that project with a variety of different projects in corner stores and other retail food settings in Baltimore. And in general, over the course of 7 or 8 different projects over the last 20 years, the result has been fairly consistent, which is that we are successful in getting these small stores or other retail food stores to increase their stocking and sales of healthier foods. We're able to increase consumer purchasing and consumption of those foods, and in a couple of places where we've measured it, we've been able to see some impact on health outcomes, like obesity. So it's all been very reassuring. But I'll have to say that one of the big challenges with these kinds of projects is the intensity, the cost, and the concerns with reach. So it's easy for me, so to speak, to work in 10, 20 stores, but Baltimore has 600 corner stores. So how do you increase that reach? And so more recently, we've been working on a couple of different projects to try to deal with some of those issues, one of which is called BUD. So BUD, now I wish I had my slides. BUD stands for Baltimore Urban Food Distribution App. And basically, it's an app that connects wholesalers and local producers, including farmers, with corner stores so that they can have better and ready access to a supply of healthier foods. And we have developed a working pilot version of the app. We piloted it in a few stores. And let me just step back for a second and talk about why we decided to do this. It's partly because what we realized after about 20+ years working with corner stores is that there's really a big difference in corner stores in Baltimore in terms of the stocking of a bag of potato chips versus the stocking of, say, an apple. So in other words, unhealthy foods are very easy for stores to stock. Typically what they do is they just, it's delivered to them, it's restocked by the delivery person. There's often special shelves or delivery display racks that are provided, including if it's ice cream, say a display freezer or that sort of thing. And so there's every reason, if you are a piece of junk food, to make it into a corner store. On the other hand, this same robust distribution system does not exist for corner stores for fruits and vegetables, for healthier foods in general. And so typically the corner store owners have to go out and access those foods themselves. So this is part of the reason, is to address that gap, which is basically, thank you for sharing my website. is to address that gap by making and to improve reach of these kinds of interventions. So we have developed and piloted a version of this app in a few stores. We're currently seeking funding to further develop the app and to help finish the design work and to implement it in a larger group of stores. The next project that I wanted to talk about is a couple of projects that are ongoing, another project that's ongoing now, and this is with dollar stores. And as you know, there's been a proliferation of dollar stores throughout the United States. I think there are 20, 30, 35,000 dollar stores throughout the country, and they're just all over the place. And they tend to be located in low income and low income, both urban and rural settings, especially not only, but especially reaching ethnic minority communities. And if you look inside these stores, they tend not to be terribly healthy. We were supported to do a study in support of potential legislation in the city of Baltimore of the 53 dollar stores in Baltimore City. And what we found was that only about at the time of this study, which was about 2 years ago, only about 5 to 10% of them carried fruits and vegetables, fresh fruits and vegetables. A much higher percentage of them, 60, 70, 80% carried canned or frozen produce. And they 100% carried candy, chips, pop, that sort of thing. So, so we did a series of interviews with various stakeholders, including community members, and we identified some of the challenges associated with dollar stores in the city of Baltimore, and obtained through, again, working with community members, a set of priority interventions, including legislation. And it's been a long, work was completed in 2023 and provided in a report to the Baltimore City Council. And it's been over the last 2 years, they've been working on legislation to regulate dollar stores. It's likely to take the form of a conditional use type ordinance. And so basically, the conditions would be things like, well, they must have, community support. There's been a lot of discussion about a dispersal component. No, you can't have more than, dollar stores have to be a certain distance away from each other, like a mile or a half a mile, any new dollar stores. And there's been some discussion about staple foods ordinance components, which would mean that they have to carry a certain stock or depth of stock of healthier foods. So I'm really pleased to report, though, that this legislation, and if I had the slide in front of me, I could tell you which bill number it was, but I have no memory of it, of the actual number. But basically, yesterday, or maybe this morning, even at this moment, it's being discussed by, publicly discussed and presented, the bill that's under consideration. And so I'm really happy that our team was able to have some role in providing information in support of the regulation of dollar stores in the city. Yeah, I'm happy to share my slides. This is my first Google Meet, and darn it. Yeah, so that's basically what I wanted to say. I mean, there's all of the results of all of the different projects in small stores and dollar stores and so forth have been published and are certainly available in the written literature, in the scientific literature. And the website was just passed to you, so there's a lot of information provided in the website as well. So I'm happy to answer any questions you might have, and sorry about the slide issue, but what can you do?
Not your fault, Dr. Gittleson, and thank you so much for winging it without the slides. Do we have any questions for Dr. Gittleson right off the bat? We also have Rial Carver here with us. Would it be helpful to hear a little bit about Rial's program and then have questions for both speakers?
Yes.
Great. Rial, we're throwing you in if you are ready to share a little bit about your program.
Yes, hello. Hi, everyone. Thanks for inviting me to attend your committee meeting today. My name is Ryle Carver.
Oh, sorry,
and
Ryle.
That's okay. Not a problem. I am the program director for the Rural Grocery Initiative. We're based at Kansas State University, and we work, as you might guess, to support rural grocery stores and rural communities with food access. We've been around since 2007 and really came together after a series of listening sessions were held across the state of Kansas in rural communities, asking rural residents what are some of the big concerns you have for the long term or for the longevity of your community. And the local grocery store kept coming up. And so that led Kansas State to dedicate some resources to this program. And I think, so our work, we focused on Kansas, but we are unique in our focus on rural grocery across the country. And so I'd say about 50 to 60% of our work is in Kansas, and the remainder spans across the country. So we are doing this work. One of the first things that we sought to understand was why is it important to be sustaining these rural grocery stores? And what we've found is that there are 3 key benefits that rural grocery stores bring to communities. One being the economic benefit that they drive in their local communities, local jobs, contribution to local tax base, and even a little more indirectly, they serve as a tool in recruiting and retaining residents in small towns. It stands to reason if you don't have a grocery store, it makes it harder to encourage people to move to your town. And if you lose the grocery store, it makes it harder to keep them there. We also recognize that local grocery stores in rural towns are critical points of healthy food access, often having better variety at more affordable prices than dollar and convenience store counterparts. And then they have a community benefit of being a cultural hub, a social gathering place, home to all sorts of community specific identity. I've seen local grocery stores with art projects from the local school district or fundraisers for the local community organization. So there's a lot of opportunity to build social capital in these stores. And yet keeping a rural grocery store open has its challenges. We've seen a huge change in competition and the players around competition for local grocery stores. There's been an almost exponential increase in dollar stores over the last couple decades, and super centers, national brands like Walmart, Costco, Sam's Club, those have only risen in number, while small town locally owned stores have steadily decreased. In Kansas, we've done some research on this, and we found over a 10-year period that about 1 in 5 grocery stores closed in rural Kansas. And that trend bears out nationally with some data that USDA Economic Research Service has studied or completed over a similar time frame. One thing that I think is interesting or is important to understand to really understand why it's such a difficult business is to understand the grocery industry as a whole. It is a very slim net profit margin business. Let's say restaurants run typically on a 10 to 11% net profit margin, whereas grocery stores fall between 1 and 3%. And so that means for every dollar in sales coming into this store, 97 to 99 cents is going towards covering operating costs. It's going towards food purchases. It's going towards your staffing costs, your rent or your mortgage, your utilities, and only 1 to 3 cents remain per sales dollar to put back into the store, to invest into the store, to bring on new programs, to add on online ordering, set up technology so you can accept double up food bucks or however that program is called in your area. And so that's where the phrase that grocery is a volume game really comes into play, meaning that a grocery store that sells 2 million, let's say, in annual sales, 1% of that is around $20,000 in net profit margin. Whereas a store with 20 million sales, that's $200,000 in net profit margin. 2 million, I'd say, is common in rural communities, or even less than that. And 20 million to 100 million in sales for some of the large brands would not be unlikely. So you really get a sense of how the volume of sales that a store is able to conduct has an impact on how that store can stay open. So it's not all gloom and doom, though. Our office is here to support rural communities. We provide one-on-one technical assistance. We maintain our website, which has a wealth of information. We have completed a variety of case studies, fact sheets, guidebooks, toolkits that are meant to highlight innovative models of rural grocery. We also host a variety of educational events. Just this summer, we hosted our Kansas Rural Grocers Retreat, which was a day-long workshop for rural grocers in Kansas, talking about operating relevant topics to operating a rural grocery store. And then the next day we did a rural grocery road trip where we traveled around to 4 different stores in the state with grocers as well as economic developers and legislators to really understand what some of the challenges for rural grocery can be. And so that's a state level programming that we do. Our flagship programming is our National Rural Grocery Summit, which is held every other year. And our next one will be in Fargo, North Dakota. But this is really the go-to conference for all things rural grocery. And I'll try to put when I find the chat, I'll put the link in the chat. Oh, here we go. So that's more information on the National Rural Grocery Summit. It's a great place for grocers to network and learn from each other, but also rural grocery advocates and stakeholders. It's a great place to learn what are some of the innovative models and talk to some of the people that are implementing those innovative models. In Kansas, we're also part of the Kansas Healthy Food Initiative, which is a financing arm. So we support investment into healthy food retail in the state through that program. It's a loan, primarily a financing program for healthy food retail, but we do have some grant options. We've just launched what we're calling our pre-development technical assistance grant, which is meant to support projects that are not yet off the ground. So soft costs going towards market studies or architectural renderings or support from an attorney to develop your articles of incorporation and your bylaws and things like that. That is one of the resources that we're able to provide. And then we also conduct some research. We are currently wrapping up a project on local sourcing in rural grocery. So it sometimes surprises me when I walk into a rural grocery store that there aren't more local partnerships in the store, but that's not for lack of interest. What we've seen is that grocers are small town grocers are interested in highlighting their local producers. They just need some more resources on how to do it. But the benefits could really have an impact on the grocer, because local grocers can be nimble and flexible, whereas national counterparts have a lot more red tape that local producers might have to work through to get their product into the store. And so we think local sourcing is a great opportunity for a local producer or for local grocers, especially for really small town grocers that may not be able to access traditional wholesale models, like traditional wholesale distributors. So the other research project we're working on right now is related to food as medicine, which has been a hot emerging topic these days. We think that rural grocers could play a role in implementing food as medicine interventions, simply by being kind of the food hub for some of those food as medicine interventions. And I say hub, not thinking of a traditional food hub, but really being as a central point for food as medicine efforts to be routed through. Lastly, I will mention that our office does some work to support other rural grocery stakeholders through our rural grocery transition specialist course. This is something we developed because we know that many rural grocers are nearing or at retirement age, and the community and the grocer really have no plan on what's coming next, who's going to take over the store. And if the store closes, what we've seen is that really has an impact on the community, and the community loses out on the benefits that we talked about earlier that the grocery stores provide. And so we've developed some resources related to transition planning and have a course now that supports economic developers, extension, nonprofit leaders, people that are maybe one step away from a rural grocery store, but are working in communities to support overall economic and community development and community prosperity, and having this sort of baseline knowledge that we provide through this course to engage with grocers and start having a conversation around what their transition plan is. That's really what the focus of the course is on. So I could talk a lot more, but that is sort of the quick and dirty overview of the Rural Grocery Initiative. I encourage you to look at our website because we have so many resources available on our webpage. So thank you so much.
Thank you so much, Ryle and Dr. Gittleson, for sharing about your work. I think that this is really helpful context for the committee. Does anyone have any questions that they would like to jump in with? I can help kick us off if we'd like. Okay, so I will share with you that the council has been tasked by the Maryland State Legislature to find ways to eliminate healthy food priority areas in the state, in both urban and rural areas. And during this past legislative session, they were asked to propose some concrete recommendations on how to attract brick and mortar grocery retailers to these areas or encourage their expansion of healthy food options. And so what the council has put forth in their report that will soon be published is a recommendation that promotes WIC vendor participation in urban areas with smaller stores, like corner and convenience stores, including like suggested funds for cold storage infrastructure to help them maintain perishable food inventory, and then also some technical assistance for them in terms of like how do they comply with WIC vendor participation or expand their offerings of healthy food options. I'm curious if there are other like clear policy solutions that you two have come across that you think would help address this issue. For Ryle, I know that you said that you've been working with the Healthy Food Financing Initiative program, and I'm curious if you've had many takers for the loan program, or like what the difference is between the grants and the loans. And I have one for Dr. Gittleson too, which is I'm curious if you've heard of any issues for the corner convenience stores or dollar stores in terms of like which healthy food distributors are able to work with them. We've heard that there may be unique challenges for those types of stores to get access to healthy foods at a workable price for them. I'll turn it to Ryle first.
Yes, thank you. I'm putting some links in the chat here. So the Kansas Healthy Food Initiative is the Healthy Food Financing Initiative I referred to, that the Rural Grocery Initiative is a partner, a part of. I also included the National Healthy Food Financing Initiative that's administered by the Reinvestment Fund. So these are similar programs, both healthy food financing initiatives, just different scopes. Kansas is not the only healthy food financing initiative that has a specific geography. There are others across the country. And so we have supported, I think, about 75 projects. Over 5 million has been lended out or loaned out. And these are going directly to healthy food retail projects across the state, both rural and urban and in between. The focus has been on healthy food retail projects in low income and or in low resource and underserved areas. So it hasn't been specific to rural, although there have been many rural projects supported. Often the projects are, or the funding from Kansas Healthy Food Initiative is just one piece of the larger package, but it depends on the scope of the project. Sometimes we're supporting renovation. Sometimes it's as a startup. Sometimes it is redoing one small part of the store so that they can include more healthy food options in their store. Maybe they didn't have the right space or the right infrastructure. And so it has really, it really has spanned a wide breadth of types of projects that we've been able to support. Early on, we had a grant only component to our program, and we quickly ran out of funds for that. So we quickly found there was just so much demand for that program, and the retailers that were able to take advantage of it tended to seek it out for support with upgrading their point of sale system. And that, in many cases, it then enabled them to be able to implement double up food bucks. So all in all, we were really glad that our funding was able to support that. But we, like I said, there was just so much demand. And I think that's probably something that exists across the country. Point of sale being something, or point of sale systems being something that are not always top priority for a grocer. There are often many other things competing for their money. And point of sale may be the last on the list, or may not be a priority until it actually breaks. And so what we've found is that many point of sale systems are obsolete. And so to be able to implement double up food bucks, SNAP online, WIC online, probably maybe even WIC in general, online ordering, any sort of intervention related to food as medicine, having an up-to-date point of sale system is really key.
Thank you. That's really helpful. Dr. Gittleson, how about from you?
So first of all, I want to underscore a strategy that you mentioned, which is getting WIC into the stores. I think that's a terrific idea. In Baltimore City, probably at the time that we did a study about 5 years ago, only about 20% or 25% max of the corner stores were accepted WIC. So, you know, you automatically improve access to healthier foods if a store becomes a WIC store. So I'm a huge fan of that idea. Another strategy that has been tested with mixed results is the staple foods ordinance idea. And as you know, a staple foods ordinance is when, you know, there's a requirement that a retail food store of all different sizes stock a certain variety and depth of stock of healthier foods. And in Minneapolis, there was a very well evaluated experience of a staple foods ordinance, and there's been other examples of staple foods ordinances enacted in different settings. And a big challenge has been enforcement. So yeah, you could put the thing on the books, the law on the books, but if it's not well enforced, then it's very ineffectual and just does not have the kind of effect that you like. So any kind of policy needs to come with an enforcement side of it, a clear enforcement side of it. Otherwise, it's not going to be effective. You mentioned, you know, how do you get better? What's the distribution system, and how can you improve the distribution system? And that's a big challenge, especially for small stores. In Baltimore, again, many of them use one primary distributor like B Greens. If you go into B Greens, last time I was there, they didn't have very much in the way of produce. They had some, but it wasn't, you know, a wide selection or anything like that. There are other distributors that do carry produce. There are produce distributors that service stores in Baltimore. The problem is there's large minimum required purchases and delivery costs, and you know, a small corner store isn't going to sell 500 pounds of strawberries. They're going to sell maybe 5 or 10 pounds, and then the cost of having that delivered to their store, plus the infrastructure issues that you mentioned, which they may not have ways of keeping it fresh and so forth for very much time. So these are some of the big challenges. I think you know, we do need to figure out ways to improve distribution systems to varieties of different stores, including these very small stores, so that they have access to a wider variety of foods. That was the idea behind this Bud app, and you know, I'm still interested in seeing if that could be workable. One thing I didn't mention about the app is that it incorporates a let's see, what's the way to put it, a collective purchasing feature. So in other words, the idea is that yes, of course, no, you know, like let's just say we're talking about strawberries. No store corner store is going to purchase, you know, 500 pounds of strawberries and sell that, because 99% of them would go bad. But a series of small stores can work collectively to purchase those foods and potentially get them at a lower price. And that was one of the main features of the app. So I do think some kind of purchasing groups, whether it's supported by the idea of an app or a website or some other digital strategy, is something that could be explored and has the advantage of being able to move to scale, as opposed to, again, Rial mentioned, like running out of money, because I mean, that's always going to be a challenge, right? So we need to think about how to make these programs and activities sustainable in the long run. And I do think that working on digital strategies may be part of the way to achieve this.
Thank you so much. Any other questions for Dr. Gittleson or for Ryle? Beth, go ahead.
Good morning. Thank you for your presentations. It was very helpful, and the links too. The county I'm in is a very rural area. And we this is years ago, had piloted putting refrigerators into the space for fresh produce. The same thing, Joel, was the purchasing power, because they're way out, and to get someone to actually get a delivery there was a challenge. But then once they got the fresh produce, they didn't have a means of turning that produce into something like a soup to extend the life of it. So there's that challenge there. So when they did go back for observation, within 2 to 3 years, it was filled with sodas and, drinks. And there wasn't really anyone to kind of say, hey, you can't do this. I mean, because they were taking a loss. I mean, so that is such a challenge. I mean, do you think having fresh frozen product that can last longer would be, I mean, France is very big on preserving their food, their fresh food. Do you think that would be a better answer than fresh? I mean, apples can last a long time, oranges can last a long time, those type of things, but
So I would agree with you that, and I'm guilty of this, what I'm about to say in this presentation. There's been an
Dr. Gittleson, we lost you.
oops.
you're back.
You're back.
Am I back? Okay, sorry. What I was saying was, I'm guilty of this sin right now of being overly emphasizing fresh produce as the be all and the end all, and this is what's going to save healthy food access, because for the various reasons that you mentioned, perishability, transportation, storage, cost, et cetera, et cetera. I actually work we've been talking a lot about my Baltimore-based work and so forth, but I actually work in rural Native American communities and contexts quite a lot. And there, in fact, we've really emphasized frozen, because, frozen produce, in fact, to some of these more remote rural locations, it takes so long to get there that if we're talking about fresh produce, there's actually some degradation in the nutrient content of the foods because it's taken 2 weeks to get there. So I'm big on frozen, and I'm not adverse to canned so long as how it's canned. Right. Whether it's like got a lot of sugar, not good. If it's got a lot of sodium, not good. But in some circumstances, I think we have to be open to things other than fresh if we're talking about produce.
Yeah. And the other thing I had was education around it. While like having that store tour, and Lisa's on here from SNAP, is having the education around it, so people know to shop the periphery of the store. They know to look for local fresh first. If it's unaffordable, to go to frozen and then to canned. Do you have that boots on the ground type of education at the grocery stores to help people navigate? Because it's much easier grabbing a meal that has everything in it already versus what I find is like people don't know what to do with it, right? So it's that whole other piece of it. If you give somebody a box of food to break down butternut squash, people don't know what to do. And that's all socioeconomic levels. That's not just lower. Is how are you doing to combat that?
So I would say that in Kansas or in our area, the people that are doing the majority of that type of content would be SNAP Ed. They are the ones that have partnerships with grocery stores and are providing nutrition education. However, I will say from a grocer's perspective that from a business perspective, pre-cut watermelon and other fruit, pineapple, even apple sliced up, it goes off the shelf much faster than whole fruit. And so for grocers, I think recently there has been some push to think about how else they could present some of the healthy items so that it's more appetizing to customers. In those cases, having some kind of kitchen is really beneficial so that you can be accurately preparing or adequately preparing those processed items. We've also seen And so that kind of goes back to the earlier comment about food waste. If you're able to utilize some of the food waste with the kitchen that you have and make a soup, like was mentioned, I think that can be a strong business decision for a grocery store. And it doesn't have to be a big kitchen. It doesn't have to be a huge space. I think there are some ways to creatively think about what's the minimal equipment that you need to be able to add on a few additional things that might bring in more sales and get more healthy food out the door.
How about mobile markets? Have you guys worked with mobile? We have a small curbside mobile market that goes into areas that don't have access to fresh produce.
Well, in Baltimore, there's been a tradition for like 100+ years of what has been called A-rabbers, but horse-drawn carts.
I remember.
Yeah, and so there's this, actually, I don't know. I think it's a dying tradition, or it's not there. There aren't too many of them left, but there is that tradition. So I would suggest in certain locations it could probably be. I mean, it doesn't have to be a horse-drawn cart. It could be a van, or it could be a lot of different things. In certain locations, I think it's worth trying in different settings, especially in settings where you do not have access to a broad array of healthier foods.
Thank you. I know I dominated. Sorry about that, Nika.
I would just add about the mobile markets that the models I've seen have traditionally been very dependent on grant funding. And I think there's still a question of the long-term sustainability of that model. If you think about the net profit margins I was mentioning earlier, essentially you're taking that and needing to, I mean, obviously you don't have the brick and mortar costs of utilities and rent or mortgage, but shifted a little bit, you're still not making a lot on, you still don't have a great net profit margin, and you are having to cover transportation costs. So I think looking at it from a business perspective is essential for it to be a successful operation, because I think mobile markets, what makes them thrive is having consistent schedules so that people can rely on it and depend on it week in and week out. And examples I've seen where they've really struggled to have that consistency, meaning they struggle to have customers there when they arrive to get food out the door.
Thank you.
Okay, you've had a question.
Yeah, so thank you all for this. And I have a couple questions. I'm going to try to ask these all collectively in a way that they make sense, just for the sake of time. And so, Annika, you started to hit on it. One of the most important things that I think happens when it comes to increasing access to our corner stores, to our smaller footprint grocery stores, really is WIC usage. And so what I wanted you all to see is that you could speak a little bit to how does our WIC usage impact our grocery stores, our corner stores. We know SNAP is really easy for folks to utilize. But it's that WIC requirement that is usually a little bit challenging for grocery store owners. And then of course it's challenging for the client, because if I can't use my WIC at a grocery store, then I'm stuck. So I wanted you all to speak to a little bit of that if you can. But I know, Annika, you did ask that question, but I think more importantly, and you were getting to this, Rael, is transportation. How has that been factored into the study and where grocery stores are placed in various areas? Because, and this is true for also Baltimore City, but especially true for our rural areas, it's not easy for folks to get to and from a grocery store or a corner store. When we think about our older adults, they may have mobility issues. There just may be a lack of transportation. So how is that factored into where grocery stores or where our retailers are interested in opening? And then also, has there been a conversation on supermarket incentives? So to incentivize grocery stores that are serving maybe primarily communities of color, that way they can offer, or different diverse populations, so that they can offer culturally relevant items to those in those neighborhoods. So how has incentive taxes been brought up in the conversation, or just the thought on centering the focus on opening grocery stores that are able to serve communities with a niche need in terms of their stocking requirements. And I know that was a lot, so told you I tried to lump it all in together.
That was a lot. Well, at the very beginning, you talked about WIC, and I think I'll respond to that a little bit. I mean, yeah, there's only 20% or less of the corner stores in Baltimore accept WIC, at least as of the last time I checked, which was about 4 or 5 years ago. And there's a reason for that. At least when you talk to them, it's the paperwork is difficult, and it is challenging. Sometimes they'll say they have product that goes bad and that sort of thing. So there are some real concerns. I do think that there is a stress point that could be addressed by this group, which is providing assistance in enrollment or maintaining the WIC participation of corner stores or small food stores. Maybe there's some role that could be played in assisting them in getting approved. I also think we need to talk to the WIC offices, because some of them, I've heard various things about their level of interest in working with corner stores as vendors, and in some places I've heard that they're not interested because they've had too many challenges working with these corner stores with, unfortunately, scanning the healthy cereal but giving the Fruit Loops or something like that. I've heard a lot of those sorts of things. The other thing I'll say is we did do a small study with 8 WIC serving, or maybe it was 10 WIC serving corner stores in Baltimore City, where we tested out a series of different behavioral economic strategies to see which might be more effective or associated with increased purchasing or use of WIC benefits to obtain healthier products. And the one piece that stood out in terms of the training, that stood out in terms of being very effective was training of the store owners to communicate, like just to say, here's where that WIC eligible product is located in my store. Here's where everything is. And so that, coupled with even simple point of purchase promotions like shelf labeling and that sort of thing, can make a difference in terms of whether, once a store has decided to stock WIC, whether it is successful or not. But I will say that first you have to get them to go through the paperwork and so forth. And many of them have told me they just don't want to do that. It's not worth it.
My only addition would be to lift up the rural perspective, and this could apply to convenience stores as well. In Kansas, there are stocking requirements, and I think it is different by state, so this may not be relevant, but there are different stocking requirements for rural versus urban stores, and rural stores are able to stock less than the urban stores. But even the designation of what places are urban versus rural has been challenging to understand. There's a clearly rural store that's having to fulfill the urban requirements for stocking standards, and as a result, they just are not offering WIC anymore or at all. And I feel like it would be helpful for those lower stocking, those rural stocking standards to apply to small format stores that would include urban convenience stores or corner stores. I'm sorry. So, that would be something to think about. If you have partnerships with the agency administering WIC, those would be some things to maybe work with them on.
Thank you both so much. Time really flew in this meeting, and we're almost at 11. So I really appreciate both of your insight, and I think that this has been a really helpful meeting for the committee. Would it be okay if our members wanted to follow up with you both with additional questions?
For sure.
Okay, great. Thank you so much. And then regarding SNAP and SNAP Ed updates, I think that we all still want them. Is there a FRAC resource, LaMonica, or another way that the members can access those updates or learn more about what's going on?
Yeah, so we just updated our kind of federal what's next. There still have been no changes. I know USDA released guidance on September 4th, but it's still a whole lot of nothing. And there's supposed to be more guidance coming down September 30th. And then we should have an update probably pretty soon from DHS on what the specific impacts for Maryland would be, but I will share the link to the updated FRAC resource.
Amazing. Thank you so much. And thank you everyone for joining us this morning. And I may see some of you in a couple minutes in environment and production. Oh, Diana, go ahead.
Can I please get a calendar invite for the next meeting?
Yes.
Thank you.
Yep. All right.
LaMonica,
everyone.
I'm going
Thank
to send you an email.
Okay.
All right. Thank you.
Thank you.
Bye, everybody.
Bye.